the National Reconciliation Officer, Chief Education Officer, or her nominee, Communicable Diseases Coordinator, the Senior Nursing Officer for Community, the Commissioner of Police, the CEO of Praxa, the Warden of the Kingston Board, the Ministry of Tourism, represented by the Permanent Secretary, and the Ministry of Transport and Works. Let me just say as well that the first meeting of the Zika Action Committee took place last week, Friday, in this very room, and there was a very good participation, and we have set the stage for a second meeting to take place tomorrow, Friday, as well, at this same venue, in addition to other things happening between today and tomorrow. Now, one of the immediate tasks that was put before this action committee, naturally speaking, will be to create an action plan. And in my hand here we have a draft of the action plan. This draft is going to be further refined, and it will be available for public consumption. And I don't want the misconception to go out there that we have, or we are waiting for the finalization of a draft action plan before we take action, because we are taking action in a very comprehensive sense. Even now, at the press conference last week, we highlighted that we brought together essentially a team of neurologists who will be able to deal with address some of the more severe complications of the Zika virus disease, should those complications manifest themselves in St. Vincent and the Grenadines. In other words, the neurologists include a pediatric neurologist, and she was here last week, Dr. Mishka Duncan Adams, and we have Dr. Siddiqui from the St. James School of Medicine, who is also at hand, and we have a specialist as well available through the World Pediatric Project, a neurologist who specializes in the condition called microcephaly. So we have that response mechanism on board. We have made some arrangements for the procurement of, maybe some of the medical supplies which may be necessary for treating cases of either microcephaly or the Guillain-Barré syndrome. We've made some arrangements to procure some medical supplies through the OECS setup that we currently have now. So we're taking deliberate action on that front as we press forward. I'd also like to say that we've embarked and we plan to make further and substantial progress on this front. Over the weekend, we've embarked on a number of initiatives that are geared at engaging the community and communicating the risks associated with this virus and possible ways in which you could mitigate or prevent against these risks. One of the avenues that we are taking right now is going to the churches, taking the message to the churches. We have, in fact, on the last weekend, between Saturday and Sunday, being able to cover some churches in St. Vincent and the Grenadines, and we expect that we would be able to cover the substantial, perhaps the remainder, or at least a substantial part of the remainder of churches this coming weekend, and we're putting all things in place to facilitate that, including making assignments of our health personnel. Because health is not just something that we take care of at clinics and at healthcare centers or even at the hospital. Health is something that we ought to be taking care of at the preventative stages. And one of the things that will be characteristic of my tenure at this ministry is a community approach to healthcare. And going into these communities, the churches in this initial instance, plans are afoot to make sure that we penetrate the schools as well with the message, and also for us to work on the community level. So we are actually taking the widest possible scope in relation to getting the message out there about this virus, and not only about Zika, but about the mosquito and what we ought to do to rid ourselves or reduce the risk of being infected by this mosquito. Of course, we reduce the risk of being infected by this mosquito when we take measures to protect ourselves against being bitten by the mosquito, and when we, of course, help to destroy breeding sites. And so I should say that we have actually begun the series of community meetings geared at sensitizing the national of intentions on the virus. I think just yesterday we had a community meeting in Georgetown. Before that, last weekend, we had a community meeting in the Sign Hill area. We are more or less looking at the hot spots, and I took the time on the last occasion to highlight the particular hot spots where there are high mosquito indices. So we are tackling them systematically. So we're taking the message out there. We have set up some structures to deal with the response, and I would also like to say that fogging, which is a part of the exercise, and I think that from the preliminary indications, the fogging is actually leading to a substantial reduction in the population of mosquitoes. I think that the preliminary evidence is suggesting that it is working. The CMO, feel free to join us at the head table. Good morning. Good morning. So the preliminary evidence suggests that the fogging is working, so we're going to continue with that. We're also going to execute, and we are in the process of I think finalizing the approach to execution. We are also looking to execute the community cleanup campaigns, and you would hear more about this as we go along. So just to say, in terms of fogging, that for this past few days, Monday to today, well, fogging today is supposed to take place along the VG Highway from Rick's Apartments up to Indian Bay. On Monday, schools in Kingston, the Kingston Port and King Garden were fogged. On Tuesday, the Mala Village and Sign Hill. On Wednesday, from the E.T. Joshua Airport to the Arnersville Plain Field. On Thursday, which is to say today, fogging is due to be done along the VG Highway from Rick's Apartments to Indian Bay, as I had mentioned. The fogging schedule for the upcoming week will be available shortly, and that I think will be sent out via press release to all the media houses later on today, I am assured by the Permanent Secretary. So we are staying on top of things to the extent possible. We are following the research and the developments in relation to the Zika virus, and we are doing our best in terms of prevention and control and organizing our national response, including a response that will help us to deal with some of the more serious complications, as I mentioned, and we will continue to engage the communities, because I think that more than anything else, the tests that this virus presents gives us the opportunity to revamp our approach to communicating messages related to health. Of course, we have Health Word and these standing mechanisms, but we have to go into the highways and byways, and we're prepared to do just that, to help us through this particular problem and to help us with other problems as they may arise from time to time. At this moment, I would just like to invite the Chief Medical Officer to make some remarks in relation to Zika, and then I'll come back and address briefly the PAHO meeting next week. Welcome the Chief Medical Officer.
Good morning, everybody. Okay, so just to further respond, update you on what's happening with Zika in the region in St. Vincent. St. Vincent and Grenadines, as we mentioned last week, I think we are coordinating our activities around the general directions, the recommendations of WHO, PAHO, OECS Health Unit. So the focus is surveillance, and that's surveillance of our health facilities, persons coming in, to make sure we pick up any persons with Zika or symptoms suggestive of, and the surveillance of our mosquito population to make sure we know what our indices are in terms of the Aedes aegypti. Also communication, and that's the main focus. As we said, communication, letting persons know. I know some persons are thinking that they're hearing Zika, Zika, Zika. Yes, let's start Zika, Zika, let's start vector control, so that we cover Zika, chikungunya, and dengue. And the other part of it has to do with research, because as you're aware, the link between Zika viral infection and microcephaly and Guillain-Barré, microcephaly in particular, has not been proven without a doubt. And what is necessary is for research to continue, to either say, yes, this is what's happening, or no, this is not what's happening. So very important in all of the region is the identification of cases and the following up of cases and establishing background information in terms of the number of cases of microcephaly a country might have. So that if in the coming months, year, we have somebody who presents with microcephaly, we have a better idea as to whether or not this is an abnormal event or if this is something that is usual. In terms of the cleanup campaigns, those will start. I know in Georgetown yesterday evening, there was a session hosted by the Ministry of Health with the Vector Control Unit and our Health Communications Unit, and that's to inform people. Yesterday we met with Action Beckway, and they're very anxious, willing, involved in working in Beckway to do cleanup, including recycling, and to make it an entire program. And we will continue. Our aim here is to keep you informed so that we all know what's happening, that you can be aware of what we are doing, what we as in the entire nation, what we need to do and to continue doing. So that's basically what I want to say on Zika this morning. I'm not sure, Minister. Anything else?
Thank you very much, Chief Medical Officer. I now invite the Honourable Minister of Health, Honourable Luke Browne. He prefers to be referred to as Honourable Luke Browne. I was insisting on saying Honourable Robert T.L.V. Browne. But I'm going to, to say to you that I've been given his approval to say Honourable Luke Browne. He's going to update us on the upcoming PAHO sub-regional manager's visit, and also the very important visit by the director of PAHO, Dr. Carissa Etienne, who's one of us. She is from Dominica, and we're very proud of that. Dr. Minister Browne.
Just to talk a little bit about the PAHO conference, well, I'd like to thank the Chief Medical Officer for the additional details that she has provided in relation to Zika. We hope that, including those of you who are here from the press, that your only role in fighting this battle isn't to come here when we have press conferences and so on, but that when we have the particular cleanup exercises in different communities, that you will not cover the exercises necessarily, but you will be involved in the cleanup work. I know that surely the only thing you are working with cameras and these modern tools, not the only thing that you're able to do. So I'm asking the members of the media and others to be involved in the cleanup work as well that we're hoping to do. Now, I didn't elaborate on it too much when I spoke, but the Ministry of Education is actually, through the Chief Education Officer, has given the instructions for messages on Zika to be crafted and to be delivered in the classrooms throughout St. Vincent and the Grenadines. So that is a natural partner in the work that so the ministry is a natural partner in the work that we're doing and getting the message out there about Zika. I would also, so much for Zika for now. We're preparing to host next week a sub-regional meeting of PAHO. It is really an honor for St. Vincent and the Grenadines to have the opportunity to host this meeting at this time. Well, there's a point of connection between the meeting of PAHO and even Zika, because there's on the schedule, I think it is for Thursday of next week. Thursday of next week in the evening, I think starting at 5:30 p.m. Where they're going to, at the NIS conference room? Okay, at the NIS conference room, there's going to be a symposium, if you will, on an aspect of our fight against Zika. There have been some proponents of some interesting ways of tackling the Zika virus, including the use of, the mosquito, and by extension the diseases spread by this mosquito, including Sorry? Okay. Including the use of genetically modified mosquitoes, male mosquitoes that would have the effect of more or less halting the reproduction of female mosquitoes and therefore eliminating the Aedes aegypti. I mean, of course, that comes with its own challenges and so on. So there's going to be a discussion on that for what it's worth next week, Thursday, God's willing, and I think that that is an open session, so the public is invited to come. Now, before the meeting itself, because the PAHO managers meeting is going to take place from Tuesday to Friday. On the Monday, we're actually going to have an official visit to St. Vincent and the Grenadines by the director of PAHO, and the director is Dr. Carissa Etienne. Dr. Etienne is actually someone from the Eastern Caribbean. She's a Dominican, and she rose through the ranks of PAHO. I think she was working in the Dominican Public Service before she was a chief medical officer. So maybe we have a trajectory for our own chief medical officer. But she worked through, she came through the public service, and now we are proud that we have someone who is leading this organization who is from so close to our shores. So Dr. Etienne is going to pay an official visit to our country next week. And she's not only concerned about, in a narrow way, about health issues. On that official visit, we will do several things, including visit a couple of the PAHO projects. And this is where PAHO becomes very significant for St. Vincent and the Grenadines. Right now, one of the most substantial things that PAHO is involved in is the development of smart healthcare facilities. And we collaborated with them, we worked with them on the smart hospital in Georgetown, and we are preparing for them to help us to get some other smart facilities, including a facility in Mairo, in the Grenadines. I think there's one earmarked for Union Island as well. Chateaubelair is another one, and there is a fourth facility that would be done, converted into a smart healthcare facility through this PAHO project. Just a few weeks or so ago, the permanent secretary, I think Tamara as well, was involved. They got together and they prepared a document that is going to guide the support that PAHO is going to give St. Vincent and the Grenadines in 2016. So PAHO is a very valuable stakeholder that has been involved with technical cooperation with the Ministry of Health and the government of St. Vincent, more broadly speaking, and we are delighted that they are going to be in this country next week, God's willing. So I was making the point that Dr. Etienne, when she comes, she will tour some of our facilities, and she's also going to take in some of our indigenous culture. We're going to take her as far out as Fancy. You know, she, coming from Dominica, has some appreciation for, you know, the Kalinago and the story of the Kalinago. So she's going to have some sense of what the Vincentian component of that story is before she leaves here. That will take place. So the official visit, she arrives on Sunday. The official visit is essentially on Monday, and on Tuesday there will be more or less internal sessions. For Tuesday and Wednesday and Thursday there will be meeting sessions going on. I should say that on Tuesday morning, as the Minister of Health, I would have responsibility for making a speech which outlines the health situation in St. Vincent and the Grenadines. So we're going to have a very active week for health coming up. And of course, following that active week for health, we're going to go into the following week, in which there will be deliberations or the debate on the budget in St. Vincent and the Grenadines. So we have a packed agenda, more or less, for the rest of this month of February. I think Dr. Keith Mitchell knew that he was on to something when he declared that we have to dedicate February as the month for eliminating the Aedes aegypti mosquito. We might as well dedicate it as the month of health, generally speaking. I mean, while we are discussing the infectious diseases and so in St. Vincent, You know that we don't only face a problem from mosquitoes, there are other challenges and so on. And recently, we actually recorded a case of what is known as H1N1, or swine flu in St. Vincent. The results confirm that. However, it was an isolated case based on our preliminary investigations, and the patient has recovered. St. Vincent and the Grenadines continues to demonstrate an ability to respond to health emergencies as they arise in the interest of our population. We'd remember that in 2009, there was something of an H1N1 outbreak that we were effectively able to bring under control. So our healthcare capacity is being tested from time to time, and I think that on every moment that we are being tested, we perform creditably. This isn't to say that we are locked in any mold of complacency. We are in an ever constant quest for improvement. That is how it has been in my own personal life, and I'm very delighted to know that that is how it is in the lives of all the officials that I am surrounded by in this Ministry of Health. We are determined to make St. Vincent and the Grenadines, or the healthcare system in St. Vincent and the Grenadines, the #1 healthcare system in CARICOM. And we will take all deliberate steps to make this a reality. Thank you very much. Any questions?
Thank you, Minister Browne. And may I, at this juncture, before we proceed with the question and answer period, acknowledge with much appreciation the fact that NBC Radio 705 is carrying this news conference live for us. Thank you so very much, Ms. Oliver and her staff. And I acknowledge all the other media houses present here as well. I see SVG TV. I acknowledge WeFM. I now have it right. WeFM. And tell me again, please. Oh yes, Searchlight is here. I apologize to the Chief Medical Officer. I was just asking her, well, where is Searchlight this morning? I don't know this face as being a part of Searchlight. And we of course have the ever-present API, as quite good Lonzo is here with us. Now we're going to open the floor for some questions, and as I said earlier, you would identify yourself and your media house, and you may ask questions with respect to Zika, and if you would wish to have any further information with respect to PAHO, you may do so. So the floor is now open, please. Who is going to come out of the blocks first?
I am not a media person, but
That's okay.
I have a question because of my question.
Yes.
Lance Nevison.
Now, before you go, Lance,
Yes.
would they be able to respond from there, or they must come here?
No. Speak for me. They might go to there, so they might want to go there. Yes. There has been talk this morning. I'm really happy to hear that there's an action plan for moving ahead with the Aedes aegypti.
Yes.
And I'm happy to know that you are being proactive here and not actually waiting for the plan to be implemented before you start moving. Now you spoke about the concentration of the vector and the areas that you've been working on so far,
Yes.
and the population indices and stuff. Has there been an area identified in the country as an area where you have the highest concentration of the vector itself?
Yeah, well, last week in the press conference, and I could refer back to the script, I don't think I have it at hand here now. Last week in the press conference, we had identified, I think, 15 areas that the environmental unit thought had the highest vectors, or found to have the highest mosquito indices. So in other words, this is to say the highest population of mosquitoes. Included in those 15, I think, areas like Rose Hall, Barley, Leyu, and we actually have them here. Right, Rose Hall, Westwood, Chumaka, Clare Valley, Connery, Byra, Park Hill, Sign Hill, Bel Air, Enums, Kingston, that's to say the city, Camden Park, Bookerment, Barley, and Paget Farm, Beckway. Well, if well, that is just to underscore the fact that it is island-wide. You know, there is nothing that is not restricted. Mosquitoes ain't have a favorite breeding ground. You know, they're not breeding only on the windward side and not on the leeward side, or on the leeward side and not on the windward side, or on the mainland and not in the Grenadines. They're breeding all over the country. So it requires a national effort. And I think that we are going to have just that, a national response. We're going to have a national response to it. We're going to organize it at every necessary level. We've started with the communication in the churches. We have something going on in the schools. We're going to deal with the communities. We're going to have cleanup campaigns and so on in the communities. The Vector Control Department right now is carrying out surveillance on properties. We're thinking about recruiting a number of young people to assist them in that work as well. We have to engage every single Vincentian in one way or the other to join us in this quest for better health of our population. I mean, when something could become so notorious that it is the cause in the sense that it spreads dengue fever and chikungunya, we just come out of that, and now Zika, then we must have a strong response. And you could rely on the Ministry of Health for a strong response.
Minister, good morning.
Good morning.
Harry, NBC Radio. Would you be stepping up fogging operations in these hotspot areas in terms of making sure that extra steps are taken to eliminate the Aedes aegypti mosquitoes?
Yeah, well, we have in fact stepped up fogging arrangements. Before the recent threat, we were more or less fogging on a need-to basis. Since then, we have weekly fogging schedules, so we're fogging daily, basically, throughout the country. I just give the schedule for the past week. The permanent secretary and the ministry will send out through the communications officer the schedule for fogging for next week, and then we continue to update the nation on these fogging schedules. So the schedule for fogging is not something that we keep a secret. You know, we do it in a very transparent way. We do it in a way that is geared at having the optimal results where mosquito population reduction is concerned, and I think that it is working. So we have to keep at it, and we'll keep at it for as long as necessary. We have enough. This is not a case where we're going to run out of the chemicals, you know. We have enough chemicals to wage this battle for a long time, and if we need more, we'll get more. CMO is itching to say something here too. Come on.
Just going to point out that even though we're doing fogging, we have to remember that fogging is only going to kill the adult mosquito. And so you can fog today, but you still have eggs, larvae breeding, so that tomorrow morning you wake up and the mosquito will be back at you. So that's why our focus must be source reduction. Get rid of the eggs, get rid of the larvae, so get rid of the stagnant water, so that even though we fog, you are not allowing the mosquito to continue breeding. The fogging is only going to take care of the ones flying around. We need to make sure no others come to replace those. Okay?
And if I may also that,
Come to the mic, Osman.
just a brief comment that I may say that fogging is has to be done in a systematic manner, in that we cannot fog every day. There are a number of factors that influence the fogging process. For example, we cannot fog daily because the mosquitoes can develop resistance to the chemicals that we use. So we are very mindful of that, and we don't want that to happen. The second thing is, depending on the weather conditions, that has to be taken into consideration. So we don't want to fog and then the wind blow away the chemicals that we have used. So we have to fog according to if the weather condition permits us to also fog. And also, once you fog an area, it will kill the adult mosquitoes. It will make sense that we go back and fog tomorrow, because you have to wait for the larvae and these things again to develop into adult mosquito to fog. So that is why we will not be fogging in an area Monday, Tuesday, Wednesday, Thursday, but we may do it this week and then in a couple of days and so on.
So thank you for that further input, which is to say that we're not we're fogging daily, but we're not fogging the same place every day. Yeah. You know, so we spread it out throughout the country. Any other questions? Yeah.
Now, you were trying to stress some of the benefits that would come from this. Now,
I don't think I was trying to stress anything. I wasn't trying to stress the benefits at all.
but you just made mention to the idea as to why you'd go about this as one of the measures. Now, could
No.
you just...
Well, what I was simply saying is that there's going to be a symposium next week during the course of the PAHO meeting here, at which the topic of discussion would be more or less the use of genetically modified mosquitoes in the effort against Zika and the Aedes aegypti. I was very careful to say that they are, well, essentially they're proponents and opponents, and there are challenges that are associated with this possibility. So it will be a discussion. It's not a case where we have adopted at the level of the government or at the ministry a policy of using these mosquitoes. But there will be a discussion on it, and you will have the opportunity to contribute to that discussion as well.
Okay, so we wait until the symposium before
Of course.
highlighting some of the challenges and so on.
Well, yes, because I mean, I'm very aware of some of the research related to the mosquito, this approach. So, I mean, but it's going to be a place where there could be a public discussion and ventilation of the surrounding issues. So I rather suspect that the question you were on the verge of asking is something that you might better ask at the symposium.
No problem.
But if you still feel inclined to ask the question, you could go ahead.
No problem. Now, you just briefly made mention to the fact of an H1N1 case that was confirmed, an isolated case.
Yes.
Could you just provide us with any other information on it in terms of the gender of the individual, and if you are at liberty to tell us, well, the community from where the person was?
Well,
and just a bit of information generally about this.
I'll ask the epidemiologist to make some.
Good morning again. I must note before I give you the information that this is not an outbreak. It is an isolated case. We've had cases of H1N1 in St. Vincent and the Grenadines. And so it's nothing new to St. Vincent and the Grenadines. As a matter of fact, the most common identified influenza that is circulating in the Caribbean is the H1N1 strain. And we've had cases of H1N1 since 2009, and successive years thereafter we've had cases. So this is one case, and it is an indication that we have our influenza surveillance up and going. We were able to detect this case in a patient who is 51 years old and is a female patient. I will not state where the patient is from nor any other demographics about the patient to identify the patient. However, the patient began with signs and symptoms of flu-like signs and symptoms on the 14th of January this year, and spent 4 days at home with the flu before she decided to go to the accident and emergency department. So it is at the A&E department that when she went on the 18th of January, she was seen by the physician there. The nasopharyngeal swab, which we will use to take the sample, was taken from the patient, sent to our labs, and then sent to CAFA, where it was tested, and the results came back positive for H1N1 PDM09. We have since done our investigations. We've met with the patient. We've met with the members of the household. The patient has since recovered, has gone back to her normal jobs. Members of the household, only one person there had some flu-like symptoms for 2 or 3 days thereafter, but has since recovered. There have been no other cases of outbreak in the community, nor where the patient is living. So that is basically that case. We continue to do our surveillance. We continue to do our weekly collection of influenza data, and we continue to have our physicians doing the nasopharyngeal swabs for to know what type of influenza is circulating in St. Vincent and the Grenadines.
Thank you, Dr. Adams, our epidemiologist. Any other questions this morning?
Sharon Garraway, SVG Television.
Hi.
Well, congratulations on your post, Minister.
Thank you. You're coming in a little late, but...
Yeah, well, better late than never.
Yeah, all right.
As well as, well, you've made a stance to be the number one in the Caribbean.
Yes.
However, we as journalists keep our ears to the ground, and it might be said that, and I'm sure that you've heard this already, that the Ministry of Health has been a bit late in response, while other Caribbean countries have already begun their activities. The perception might be out there still that we are not seeing as much as should and could be done. What is your response to this?
Well, I don't know if there's a systematic approach in other countries at this time to take in the message, first of all, to churches. Because, I mean, a big part of our response has to be about the communication. I haven't heard that any other country is doing that. I haven't heard that any other country is systematically taking the message into schools, even though I suspect that they will all be looking to do that. I haven't heard of there being a widespread grassroots community approach to looking after or to taking the message into communities as well. And on top of that, I think we have actually been very proactive. I think we've been out front. I mean, if there are some specific cases of another country doing something and we having the opportunity to learn from that other country, then by all means. But as it stands now, we do not have any cases in St. Vincent. We engage in the community in as broad a way as possible. We're carrying out our fogging. We've put together a team of experts who could deal with some of the most serious conditions of Zika, including the microcephaly and the Guillain-Barré syndrome. We have made arrangements to get some of the medication that might be required to treat people who are affected by Zika. Surely there may be other things that we could do, but I don't think that we are lagging behind by any measure. And the Chief Medical Officer would say something more.
Thank you, Minister. The perception that we are lagging behind, I think, is something we really need to work on. However, I need to point out and take this opportunity to point out that the Ministry of Health, Wellness and the Environment has been working on the reduction of the Aedes aegypti mosquito, recognizing that this is the vector and recognizing that this is our focus. And this move, as Minister said before and as Dr. Adams said before, we have been tracking their surveillance on where we have our mosquitoes, where we need to focus in. Our messages on Zika in particular started in December, and we have been in November. Sorry, doctor's correcting me. May 2015. We have heightened our activities. Even though we are saying we launched our Zika response plan last week, if you look at the document when we are finished, you will note that we have cataloged all of the stuff we have been doing since then. We have been on radio programs, we have been in the paper, we have been on television, we have been on social media. Obviously, we need to always step up. We can always improve to get the message out more clearly. But the idea that we have been lagging behind in our response to Zika, I think, is wrong. And if it is that we need to speak more clearly, so for example, we're having this press conference today, we had one last week. Yesterday we were on API. Somebody commented that all they were hearing was Zika, Zika, Zika. So we will hear Zika, Zika, Zika. In terms of the OECS cases, just reminding me of the OECS response, where the CMOs of the OECS issued a release in January. We issued the release of the head of the OECS, Dr. Mitchell, and that was yes, it's giving me, that was a joint release. So again, I stress, we have been working on what is the major problem. Vector control, reduce the source, and that has been our focus, and that will continue to be our focus. We will keep people informed. As Minister mentioned this morning about the H1N1, we will let you know. If something is happening, we let you know. We provide the information as it comes to hand. Once we can confirm, clarify, we will give you information. Accurate, prompt information. You asked about the symposium next week. The symposium will include an entomologist from PAHO from Geneva who will join us via Skype. It will be hosted by the director of the PAHO. We would have a presentation by our vector control unit. There will be a discussion on what needs to be done to control Zika, including genetically modified mosquitoes. A discussion. This is the aim of the Ministry of Health. We know that in health, the major thing is information. People need to be able to make informed decisions. And we have to up our game in terms of getting the message out, the media we use. We have a Facebook page, we use a government website, we are using blasts on the line, the phones. We're getting the message out. And I do not accept that we have been lagging behind.
Boswick from WFM.
I think I'd just like to direct this to the Chief Medical Officer. But it was mentioned that the patient, the isolated case that we had with the H1N1, the person, it took about 4 days before they actually went to the hospital. Now, there are some persons who they might begin to feel ill. They think, okay, maybe I have the flu. But then they just think, oh, it's just a passing something, so they'll just stay at home. Would you have any specific appeal for persons once they're feeling ill, especially once it persists for a number of days, to really go out and seek medical attention rather than just staying home, because you never know what it might turn out to be, especially after further testings are done?
Okay, so we have to have a balance. As Dr. Adams says, H1N1 is the most common flu in the area. The latest hype in Trinidad was because they had some deaths, and those deaths were in persons who had other conditions going on. So the average person is going to get H1N1 and be fine. What we would recommend is that if you have a flu-like symptoms, I mean, right now we want to focus in on the Zika. So you have a flu with mild fever, red eyes, body aches. That is more of the Zika. That's what we want to be looking for. In terms of any other symptoms, okay, you've been home, you've been unwell, you're not getting better. Yes, you should probably seek your health professional. It doesn't necessarily be in the emergency department. It could be any of our district clinics. It can be your nurse. You don't have to see a doctor to make that assessment. The nurse is quite capable of making that assessment and determining whether or not that person needs to be referred to someone else. You also have your private physicians who are involved in our surveillance loop. So I'm not going to say, Dr. Adams wants to, yeah?
I was just going to say that, like all other medical conditions, we do advise our patients that once signs and symptoms persist beyond what we will consider to be a reasonable time or normal time, that you should seek advice from your healthcare professional. So if you have a flu and you notice that it is lasting 5-6 days and persisting, then you should go to your healthcare provider and they will look into it. So what we're not saying that you feel sick today and you're alarmed and think that you have H1N1, so run to your healthcare provider. But then you should know yourself and know if you feel if it's getting progressively worse, and so that you should go to your healthcare provider. To go back on what Dr. Keyser said about comments that are made on that we're lagging behind, I think that to make such a statement is very irresponsible, because when you say that we're lagging behind, you have to say in what areas, because there are many areas that the fight against Zika entails. Is it that we're lagging behind in putting out the messages? And if so, this is not true, because in 2015, May of 2015, we issued our first release where Zika was concerned. We were advised by the Pan American Health Organization that they've noted the first case of Zika virus in the Americas, and specifically in Chile. And so we let the nation know that the World Health Organization informed us that the first case was detected there, and we have the potential vector, which is the Aedes aegypti. We have a population that is naive, that have never been exposed to this virus, and so it presents a potential for an outbreak in the Americas that we're seeing now. We have then issued subsequent press releases where Zika virus is concerned, telling people what is Zika virus, what are the signs and the symptoms, what to look for, and what is the treatment, and also focusing on mosquito control that we are trying to do, because that is the only way that we can really fight against these vector-borne diseases. So is it that, or is it that where the fogging is concerned, and Minister highlighted, the fogging schedule and what we do in terms of fogging, or is it in source reduction? And in source reduction, we have continued to let people know to examine their houses, to look around their communities, to destroy breeding sites for mosquitoes. So when you come and say that we're lagging behind, you have to say in what area, so that, and also we look at it as how we can use that. So if you say we're lagging behind in this area, then we can then say, okay, we need to do more health promotion, or we need to do more vector control, or we need to do more education in our schools. So to make a general and broad statement like that, I don't think it has any real merit to it.
Thank you. Dr. Adams? Right.
Once again, Sharon Garraway, SPG Television. In terms of the disease affecting, well, apparently in Brazil, women with the babies, what advice would you give to women who are, well, not just women, because it's a man and a woman, couples who potentially want to have a baby this year, or women who are pregnant now and have concerns? I know that you mentioned it before, but maybe there's another woman right now listening, or a couple listening, who has not heard this advice. So what advice would you give to them in terms of this Zika virus and how it apparently affects babies, and knowing that it does not have a vaccine or anything like that?
But my advice would simply be consistent with what the World Health Organization is recommending, and they are not recommending that you postpone or delay pregnancy as such. In fact, their recommendation is that you take precautions. So we have counseling, which will be available, prenatal counseling, but the advice is that you just take precautions to limit your exposure to mosquitoes. But I mean, we don't want to get into the business of advising people on a very personal decision, in these circumstances.
And we'll continue doing our family planning, which is we give people the information so that they can make an informed decision. As you correctly said, they link, and that's what it is now. It's an association. There's no proof that there's a causation that definitely Zika viral infections would result in a baby with a small head. So we are informing, we're keeping all of our healthcare practitioners up to date in terms of what information is there. So anyone, and through this media, anyone thinking of, contemplating having a baby, we inform them about risk, suspicions, what information we have. So just as we will inform about the risk to a patient who is older and who might have problems in pregnancy, we would provide all patients, all families, all couples with the information to know what are the probable risks, what would be done throughout the pregnancy in terms of counseling, monitoring the fetus, to look at the head circumference. We would also inform them about the accuracy or the lack of accuracy in terms of diagnosis of microcephaly in utero. And the post-birth, we have already put in place, as Minister said, if we have a case, and even if we don't have proof that that case is related to Zika, because there are other causes of microcephaly, that child will be supported, that family will be supported in every way we can in terms of health-wise. Just want, you finish with that one? Okay. We just wanted to expand on our communication aspects. So communication involves, so we are here speaking to you with the press, we are putting things in the paper, we put things on Facebook, we put things on our government website, but we also go house to house and door to door, and we have been doing that. And that is a major part of our cleanup campaign, where we are going from home to home, business to business, school to school, church to church, spreading the message. And each time we give someone the message, they can then give somebody else. Health, as we say and repeatedly say, health is a shared responsibility. There's no way the minister, as brilliant and as energetic and committed as he is, or his staff, as energetic and committed as we are, there is no way we can do that alone. This is St. Vincent de Grenadines. Even if we are doing our healthy thing in our homes or here in the ministry, if the rest of the nation isn't doing it, we are all ill. So this is a shared effort, shared responsibility, all hands on deck.
Any other questions? There being no other questions, I ask the Permanent Secretary to make closing remarks.
Thank you, Minister. And I think it's at this point that we bring the curtains down on today's news conference. I want to thank each media house present here for being present and for asking the relevant questions, and we look forward to your reporting. I want to thank the persons out there who have listened to this news conference via NBC Radio 705. And I also want to thank again the management and staff of NBC Radio 705, Miss Oliver and her team. This has been, quite welcome. And we want to assure you that we will continue to update the nation, not just on Zika and what we are doing, but also on every single aspect of health and healthcare delivery. It's important for us to communicate what we are doing. We have to highlight all of our achievements. Of course, we have the challenges, and we're working feverishly in-house to address our own challenges. And we get a lot of support regionally and internationally. And I want to emphasize to you that with respect to Zika, let me add to what the Chief Medical Officer said earlier. All of the chief medical officers in the region are working collaboratively to address Zika and its effects throughout the OECS region. So there is indeed a coordinated response. Let me emphasize that. There is a coordinated response. The chief medical officers meet virtually every week. But I see virtual meetings I'm talking about every week, and they address the highlights, and they discuss what needs to be done, and they agree certain actions. And whenever we come to the public, we throughout the OECS, we're coming as a consequence of that coordinated approach by the chief medical officers. I want to thank you all here again this morning, and I assure you that we will have you here very soon again. Thank you very much.
NBC Radio.
Through the valleys, over the hills, and across our beautiful waters. Star FM 98.3 and 104.7, shining through just for you.
And that's from St. Grenadines was a live press conference, a media update on the Zika virus by the Ministry of Health, right here on the Star. It's 5 minutes after 10 o'clock. We're going to take a short break. When we come back, we're going to get things started on our Shaker program, Revelation Thursday, the leading daytime program here in St. Vincent and the Grenadines.
Win a whole lot of money with the scratch cards of the National Lotteries Authority. Get the scratch cards, today payday, and cash in a snap. Win up to $5,000. For only $2, there's Money Magnet with a top prize of $10,000. Spend $3 for hot dice and win up to $25,000. There's even more. Get a mobile money or casino cash scratch card for $5 and you can win up to $50,000. Hurry, get your scratchy at all Lotto agents. There's cash to